Hi, good afternoon, everybody. Today I'm going to be talking about genital herpes, and my name is Sutasini Nitisuntorn. So just a breakdown of what we're going to be discussing about today. We're going to be talking about what genital herpes is and why is it a public health concern, the mode of transmissions of genital herpes, certain signs and symptoms of genital herpes, how do we diagnose genital herpes as a physicians, and certain risk factor that can increase your chance, or high risk behavior that could increase your chance of contracting genital herpes, as well as methods of preventions and treatment. So what is genital herpes? Genital herpes is a commonly sexually transmitted infections caused by herpes simplex virus 1 and herpes simplex virus 2. Both viruses are known to cause genital and oral ulcers and are lifelong, meaning that the virus is in the body even when there's no symptoms, and once you are infected, then it stays in your body long term. And most cases of genital sores are due to HSV2, although this trend is now changing. It doesn't matter if you have oral or genital ulcers. Both strains of HSV are as common nowadays. So why is this a public health concern? WHO published a study in March 2020 saying that roughly 5% out of the entire world's population, which is approximately 187 million individuals, have suffered from at least one episode of herpes-related genital ulcers in the year 2016. And most of these episodes are due to HSV2, and which can recur frequently over many years. So its modes of transmissions. As I've already mentioned earlier, that HSV is contracted through sexual contact, including vaginal, anal, or oral sex with someone who is infected with HSV. And after the initial infections, the virus usually lays dormant in the body and can reactivate several times a year depending on that individual's immune system. If that individual become infected, then you can be contagious even if you don't have any visible sore, or basically you're asymptomatics. The virus can also be passed on to babies during vaginal delivery only if the mother has active lesions at the time of giving birth. Fluid contains the hepatic sore carries virus and can cause infections. And you cannot get herpes from just touching an object, or like swimming in a pool, or sharing toilet seats with someone who have herpes. Certain symptoms to look out for genital herpes include some pain and itchiness in the area, especially the genital areas, until the infection clears off. Some bumps and blisters that may appear as a few days to a week after the infection. Some ulcer like looking that looks like a blister after that can rupture and form ulcers, similar to the picture in the last slide, I think here. And a scab, which is basically like crusting of the skin over time as the ulcer starts to heal. So how do we diagnose genital herpes? Most often, your healthcare provider can just diagnose genital herpes from just doing thorough history taking and as well as physical exams, because the rash is very characteristic. It appears in group, it looks like blisters, clear vesicle lesions, but there are also certain lab tests that you can do to diagnose. For example, viral culture, PCR, and serology. And these can be done by just drawing out your blood or just doing a swab from the lesion that you have. Certain risk factors include multiple sexual partners, having sexual relationship with someone who has tested positive for for herpes, being a woman. Although the virus is more common in women than men, the infection spreads more easily from men to women. And lastly, having unprotected sex, either vaginal, anal, or oral. And please note that that even having a protected sex with condoms may still expose you to herpes, because sore can appear in areas that's not covered by condoms. So what do you do if you get genital herpes? Go and see physicians. Unfortunately, there's no absolute cure, because but once you're contracted with this virus, it stays in your body forever. So there are certain medication, for example, oral acyclovir, the valcyclovir and famciclovir, that you can take to basically reduce the remissions and reduce the symptoms. And there is potentials for recurrent episode, asymptomatic viral sheddings, and attendant risk of sexual transmissions. Therefore, if you are if you know that you might have genital herpes, then you should inform your current sexual partner about the conditions, as well as inform future partner before initiating any sexual relationship with them. And those who haven't contracted any genital herpes yet should refrain from any high-risk behavior that I mentioned in the risk factor slides. So this is one of the quotes that I came across while I'm doing some research for this presentations. And yeah, I hope you enjoy this short presentations, and these are the references. If you have any more information, please don't hesitate to contact me through email or phone number if you want. And thank you so much for your attention. Bye.